This is our GI project. We're doing small bowel obstruction. I'm Cassie Bodie,
Allison Kierkestner,
Maureen Taylor,
Kelsey Earle,
Kaylee Crouch,
Lindsay Jones. Hi Allison, how are you today?
Okay, how are you?
I'm good. I'm going to be your nurse. My name's Maureen. This is my nursing student.
Hi, I'm Lindsay.
Hi, Maureen and Lindsay.
So, what's been bothering you lately?
Well, at first I had really bad diarrhea, and then for the past week I haven't had a bowel movement. And
Last week?
past week. So I haven't been able to pass gas, I just feel really bloated, and I've had a really bad fever.
Oh, okay. Have you vomited at all?
Yes.
What did your vomit look like? Did you notice what it looked like?
At first it just looked like food, and then after a while it turned like greenish and then darker.
Okay. And have you had any abdominal distension, or have you noticed your abdomen looking bigger?
Yes.
Have you been thirsty at all?
Yeah, I feel really dehydrated.
Really dehydrated? And do you have any discomfort in your abdomen? Like, does it hurt?
Yeah, it hurts a lot.
Okay. All right, what I'm going to do is I'm going to take a look at your abdomen, and I'm going to listen to your bowel sounds. I'm going to palpate your abdomen. I'm going to take your vital signs to see how bad your fever is, and we're going to go from there. Okay, Lindsay, what were her vitals?
For her temperature, I got 101.5, her respiration's 18, pulse 95, and blood pressure was 124/78.
Okay, so your pulse is a little elevated, and so is your temperature. So I'm going to go ahead and assess your abdomen now. I'm going to move your gown up. Okay, so I can definitely see that your abdomen is distended. I'm going to go ahead and measure it so I know that the distension doesn't increase. Is that okay? Okay. Well, I'm going to have you, can you sit up a little bit? I'm sorry, I know it hurts. Okay, I'm going to measure it really quickly. Okay, so I can see your abdomen is 36 inches, so it's a little distended. We're going to have to monitor that every 4 hours so we make sure it doesn't get any bigger. I'm going to need to pull this up again. I need to auscultate or listen to your bowel sounds. So I'm going to do that really quickly. And then I'm going to palpate, and I know it's going to hurt, but I have to see if there's any masses or anything. Okay, your bowel sounds are definitely very hypoactive. I could barely hear anything. So now I'm going to palpate your abdomen, and you're going to have to tell me where it hurts, okay?
That hurts.
That hurts a lot?
Yeah.
All right.
Oh, that hurts too.
Put it over here.
Yeah.
It hurts? Your whole abdomen hurts?
Mm-hmm.
Okay. All right. Well, I'm going to go tell the doctor about your vital signs and what I found when I was assessing you, and we'll be back to talk about your results, okay?
Okay.
All right.
Hey Allison, I'm Dr. Bodie and this is Dr. Earle.
Hi.
And we just came in to talk to you about your diagnosis, if you want to talk to her about that.
Okay, Allison, you have a small bowel obstruction, and that's caused by a number of things. Most commonly, it's caused by post-operative adhesion, or it can be from Crohn's disease or hernia. And a small bowel obstruction leads to proximal dilation of the intestine due to GI secretions and swallowed air.
Oh.
This bowel dilation stimulates cell secretory activity, resulting in more fluid accumulation. That's why your abdomen is so distended. This leads to increased peristalsis, that means increased movement of your intestine, above and below the obstruction with frequent loose stools and flatus. The small bowel obstruction can either be a simple obstruction in which there is no alteration in blood flow, or a strangulated obstruction, and that means that there is an impairment in blood flow and there can be necrosis and tissue death. Strangulated SBOs are most commonly associated with adhesions and occur when a loop of distended bowel twists and the arterial occlusion. If left untreated, your condition could lead to tissue necrosis of the bowel tissue. Early in your course, you had increased peristalsis and flatus, and now that it's later in the course, you have hypoactive bowel sounds, and your abdomen is distended.
Okay. Okay, so we're just going to go ahead and talk to you about your surgical procedure. Medical intervention depends on the cause and the severity of the obstruction. Your bowel is fully obstructed. Strangulation and tissue death has occurred, so this calls for a surgical intervention. The obstruction was caused by adhesions, so a surgical procedure can be done to divide the adhesion to which the intestine is attached to. So we'll be removing the section of that affected bowel. And with this, you will be provided with IV fluids, and that will help replace the depleted water, sodium, chloride, and potassium levels. Okay? Do you have any questions?
No.
Okay, well, Dr. Earl and I will be seeing you soon.
Hello.
Hi, Maureen. This is my mom, Kaylee.
Hi, nice to meet you.
I'm the student nurse, Lindsay.
Hello.
So the doctors were just in here and explained your procedure. Do you have any questions?
No.
Okay, so I'm going to tell you a little bit about what's going to happen before your surgery and after your surgery. You're going to be NPO, which means nothing by mouth, and that will prevent your risk for infection when they cut your abdominal open. And after the surgery, we're going to place you in what's called high Fowler's position, which will help you with your respiratory. It's just sitting you far up in bed. And you're going to have an NG tube put in, which is a nasogastric tube. And that's just going to go in your nose and down your stomach to help with feeding and if we need to do any suctioning or anything with the surgery.
Okay.
Do you have any questions?
No.
Okay, well, we'll see you in a little bit.
Okay.
So what do you think the priority nursing diagnosis for this patient will be, Lindsay?
I would say probably fluid volume deficit related to abnormal loss of gastrointestinal fluids.
Very good.